Hey there, my fellow nurses and nursing students. Today we're diving into the nursing theory of Kari Martinsen. A prominent figure in nursing philosophy will explore her philosophy of care, its key aspects, and the scientific foundation upon which it is built. So grab your notebooks because class is in session. Kari Martinsen is renowned for her profound insight into nursing care. Her theory is grounded in the idea of caring as the very essence of nursing, but it is so much more than that. To understand Martinsen's theory, let's start with her view on paternalism in healthcare with this quote. The modern patient does not want paternalism. We must start by recognizing the patient's dignity as an individual and provide the opportunity for self care. With this, Martinsen is saying we need to allow the patient to make their own decisions. Yeah, I know it sounds very simple to say it like that, but throughout my time in healthcare, I have seen so many nurses, student nurses, different nursing assistants not being able to allow the patient to make their own decision. Martinsen is a big advocate for weak paternalism, where we nudge them in the right direction. We don't say to the patient, you have to do this, which is paternalism. We instead say, I think it's a good idea that you do this because the science says this and we know this about your disease. That way we have given them a nudge, but we have also given them the opportunity to make up their own mind. But let's continue on. Martinsen's theory focuses on several key aspects of care, and let's break them down. First key aspect is recognition of vulnerability. Martinsen emphasizes that patients are often in a vulnerable state when seeking health care. Nurses should recognize and acknowledge this vulnerability, treating each patient with sensitivity. The second key aspect is that she advocates for nurses to be fully present with their patients, both physically and emotionally. This means actively listening, empathizing, and providing support. And that leads us to the third key aspect, respect for individuality. Martinsen stressed that every patient is unique with their own beliefs, values, and experiences. Nurses should respect and honor these individual differences. And how we do that? Well, stay tuned to find out. But before we come to the implementation, we just need to cover the fourth key aspect, meeting the patient's inner needs. Beyond physical care, Martinsen's theory encourages addressing the inner needs of patients, including their emotional and spiritual well-being. And with those key aspects, we have a general idea of what Martinsens think. We have a general idea of which direction we need to go. But let's talk about how you, as a nurse, can apply Martinsen's theory in your practice. Firstly, you must remember that caring is the core of your profession. Martinsen's theory reminds us that nursing is not just about technical skills, it is about tending to the whole person. Secondly, when you interact with patients, well, your practice has to have an attentive presence. Be fully engaged with the patient, listen to their concerns, and strive to understand their unique needs and perspective. Thirdly, embrace the patient-centered approach. Recognize that the patient is an active participant in their care and involve them in the decision making to the extent that it is possible. And when we say to the extent that it is possible, you have to take into consideration their mental state, their cognitive abilities, because if you are working with someone who has a mental retardation, they will have another cognitive perception than when you're working with someone who doesn't have a mental retardation. They will have to get simple choices. Do you want to do this or that? Whereas if you have someone with a higher mental ability, you will not give them, say, oh, this and this. You will say, the smart choice I will recommend is this because of this, and that. Whereas fundamental retardation, this or this. So there are several key things to take into consideration, but basically focus on the patient you are helping. And we're not finished yet, because let's talk about the scientific evidence behind Martinsen's theory, because she actually has some scientific evidence. And to understand the scientific evidence, we have to go into the root, because Martinsen's theory is deeply rooted in the philosophical works of Martin Heidegger and Emmanuel Levinas, amongst others. Her emphasis on recognizing patient vulnerability and the ethical dimensions of nursing care is informed by these philosophical principles. So yeah, scientific, philosophical, well, these philosophers are actually rooted in philosophical research. So there are a scientific proof behind this. It is just not the scientific proof we are used to when we are talking about nursing theory. And in essence, Kari Martinsen's theory challenges us to rethink the way we provide care. It is a call to shift from paternalism to patient-centered care, or as she will call it, weak paternalism, to embrace the uniqueness of each patient and to recognize the profound role of caring in nursing. As you embark on your nursing journey, remember Martinsen's words. Caring is the very core of nursing. It is the nursing that I believe in. It is a very saying quote, and I will leave it up to you to interpret it. And if you want to be better at delivering high quality care, then you have to check out this video I have made especially for you to get smarter on nursing theory. So check it out right now. And if you have any questions, leave them in the comments.